Welcome to this week's episode of Promising Young Surgeon, where we delve into the challenging yet rewarding journey of becoming a surgeon. This week, Dr. Ceisha Ukatu joins us to discuss her experience as a successful Black female ENT surgeon. Today, we shine a spotlight on a crucial but often overlooked aspect of surgical training, the representation and experiences of minorities, particularly Black physicians. According to recent statistics, Black ENT surgeons represent only 1% of all ENT specialists in the United States. This stark underrepresentation highlights broader systemic challenges and disparities within the medical community. As we explore the experiences of Black ENT surgeons, we gain valuable insights into barriers that they face, unique perspectives that they bring, and the importance of diversity and inclusion in surgical practices. Minorities in surgical training often encounter multifaceted obstacles, ranging from limited access to mentorship and resources to implicit bias and cultural barriers. Black residents either leave or are terminated from training programs at far higher rates than white residents. According to an unpublished analysis by the ACGME, cited in the Stat News article from June 2022 on this topic, Black residents account for about 5% of all residents, but accounted for nearly 20% of those who were dismissed from programs in 2015. A 2020 survey of 7,000 residents found that nearly 25% experienced discrimination based on race, ethnicity, or religion, with the highest rates for Black physicians. The study found that discrimination led to higher rates of burnout and not finishing residency. In today's episode, we have the privilege of speaking with a trailblazing Black female ENT surgeon who shares with us her journey through residency training and beyond. She is one of my favorite doctors of all time. Her story embodies resilience, determination, and a commitment to excellence in the face of adversity. Join us today as we advocate for a more inclusive and equitable future in surgery. Dr. Ceisha Ukatu is an otolaryngologist from Texas. Her second home is in the Midwest, where she met her husband. She is an avid tennis player and started a book club. She and her husband have a 2-year-old daughter, and family time is cherished above all else. Thank you so much for joining me today, Dr. Ukatu. I do have to share that Dr. Ukatu is one of my prior chief residents. She is one of my favorite doctors in the world. She self-describes as a shy extrovert, and I would describe her as one of the gentlest souls that I've ever met in medicine. And I have certainly learned a lot firsthand from her over the years.
Thank you, Frances May. That's really kind of you to say those things. I really appreciate it.
Absolutely. No, it's such a joy to chat with you, and we really appreciate you being on here today. So I'd love to kind of start at the beginning of your career in medicine, like what led to your initial interest, and then how did you end up deciding on ENT?
So my initial interest that started as a child, I had a chronic disease. I have sickle cell disease, and I spent a lot of time in the hospital. And even though I was sick a lot, I felt that it wasn't so bad because of all the people around me, the nurses, the doctors, who were so helpful and helped me get through really hard times. And that example is what propelled me to want to be a physician.
Wow, that's really incredible. I definitely feel like that totally makes sense. You know, hearing this from you, learning this about you, there is this like much greater perspective and depth that you have always had as a physician and as a surgeon that I've seen. But it makes sense if you come from this experience of having been a patient for many years,
exactly.
you know, for your life.
Definitely. And I think the other thing it brings, especially like being a sickle cell patient, is that typically when us in medicine think of sickle cell patients, we think of kind of, a lower economic status, less educated kind of person. A lot of times we're labeled as drug seekers. And that's just not the case. And I feel like I can be a good example to people, showing that, that's not what a sickle cell patient is. There's lots of us who are out here thriving and living beautiful lives. So it just goes back to, what we hear over and over again, but representation matters, whether it's race, ethnicity, disability, illness, all kinds of representation matters.
That's so true. Thank you for breaking the stigma. And like, I can imagine if I was a young person or encountering sickle cell disease or anything like that, like, yeah, it is life changing to then see a woman like in her 30s killing it, extremely successful, like,
Yeah.
genuinely, like with a healthy family, with, a thriving medical practice, surgical practice. That's really incredible. And I guess so. You knew that you wanted to be a doctor. You knew that you wanted to stay in medicine. Your own experience sounds like it was very impactful and also positive.
Mhm.
And then what brought you to ENT specifically?
So when I started medical school, I didn't even know what ENT was. I just randomly, we had these small group advisors, and my small group advisor was like, I'm an otorhinolaryngologist. And I was like, what the hell? Like, why can't I have a pediatrician? All I want to do is be a pediatrician. So I knew I wanted to be a pediatrician, went through third year of medical school and did peds, loved that, did that pretty early on. But then I did surgery, and it was one of those things, like surgery was not even on my radar. But I just knew when I stepped into that operating room, like this is where I had to be. Like I loved everything about operating and how it made me feel and like the work that we were doing. And from there, I knew I wanted to be a surgeon. And it was just like, what kind of surgeon do I want to be? And, you know, at the time, I was still a little bit interested in pediatrics. So, as even as a general ENT, we get to see lots of children. So that definitely drew me to it. I love that, we take care of, usually, especially out in general practice, more like quality of life issues. And so I felt like I could have a huge impact on quality of life.
That's great. Very true that, ENT is one of those surgical subspecialties that gives us the opportunity, the option to have a big pediatrics component of the practice. I would definitely love to hear, like, how much of your practice would you say is on the ped side of things?
Well, the funny thing is after I started residency, I realized I didn't really like peds as much as I thought. But even with that, I would say probably about 20% is, which I'm fine with. Like, I don't really want more than that. Like,
That still
uh,
brings that's a lot. Like,
yeah,
yeah, I would also
yeah,
say I'm probably at 20%, and it's wonderful. Like, we have a peds room
yeah,
all done up with like giraffes on the
yeah.
walls and stuff, but like, yeah, we've got biters coming through.
Yes, I mean, I love the kiddos, but it's just easier for me to treat adults.
Perfect. So, then you do basically it sounds like you just got called by the OR. Like some people call it
Yes.
the call of the void, which I love. Like that's like
Yes.
this French term, the call of the void, but the call of the OR. And so you fell in love. It sounds perfect because you already did have kind of like an ENT mentor. And so able to
Yeah.
like
Mhm.
bring that all together. And
Definitely.
then, I'd love to just kind of chat about like your formal training experience then. Because, of course, we both completed ENT residencies. Those are 5 years after medical school. And then at the end of those 5 years, then you can practice general ENT if you choose to, versus choose a fellowship, which is additional 1 or 2 years of training.
Residency was okay. I I mean, it was residency. So it's residency, it's hard. A little background about the program. It is in the Midwest. It's in kind of a smaller town in the Midwest. It is a predominantly white area. There's not a ton of diversity. And so there's already, like you mentioned before, there's already not that many Black people within the field of ENT. So I was the first Black ENT resident at that institution. And so, as you can imagine, residency is already isolating, but just being the only one of someone can even make it more isolating. It was hard, but I feel like I was trained well. I went and I did what I was supposed to do, which was train to become an ear, nose, and throat surgeon. And I feel like I'm very comfortable and have been successful doing that.
I have the privilege of like knowing you from residency and from that aspect of work. And so I definitely do want to speak to a little bit like my experience is that you were fourth year when I came in as an intern, and then of course you were a chief during my PGY 2 year, and so we spent some good years together. Like it was a
Yeah.
wild ride, but like those are formative years for a young resident. They're like often like kind of scary years for a young resident. That's like a very steep learning curve, particularly during probably the second year, I would say. But some of my best memories of residency are even like at the VA, we did a rotation that was like a fifth year, a third year, and a second year. They made up a team over there. And when I was the second year on Cece's team at the VA, it was like those were truly some of like the best months. Like it was lit.
Yes.
And what I mean by that is just that I want to start with this quote. The quote is, intimidation is the lowest form of management. And I think that's true. Like, and if you guys have ever heard me at all really like speak on any of these issues, I truly believe that that's the case. And Cece just like really embodied kind of the opposite of that, because I've never seen her kind of like resort to some of this low hanging fruit, like scaring someone or intimidating someone or using fear to try to like teach a point or reprimand or anything like that. And so I'm being very serious when I just say, like, when I worked under you, like, and I worked for a team that you were the leader of, like, those were very positive memories. I wasn't like dreading going to work, and I wasn't terrified at work. And also, one of the reasons why I've learned a lot from you is just because I feel like I've asked you every version of maybe like a clever question, but also very dumb questions. And you're always like, all right, you're like, okay, so we're doing this today. You're like, okay, we'll talk about it.
Yeah. Yeah, those words are really nice to hear. I think that, my main goal is just to be like a good person and be like the type of person I would want other people to treat me as. Yeah, I just try to be nice. I know that, and kind, and not, be upset if people make mistakes or, things don't go the way that we plan. It can be hard, obviously, like during residency, things happen. But I think, we will all just do better and be better if we're just kind to people.
Do you feel at all like, because you are a woman, because you're a Black woman, that by having such a kind leadership style, that people ever like mistake that for just being a pushover, or they mistake it for something else?
Yeah, I think that was an issue pretty early on in my residency. So during my first year, I did really well, especially on the off service rotations. Like I felt like I excelled. And then when I became an ENT as a second year, because back then we didn't have a full year of ENT, but when I started, being more involved in the daily runnings of ENT, I wasn't super confident yet. And I think that's normal as a second year resident. Like if you're too confident, that would be a bad thing. But I wasn't good at like maybe as good as other people at as masking that.
Yeah, pretending to be confident.
Yeah, exactly. And so some people do a lot better than others at that, and I was not that person. Like if I don't know something, I'm not gonna pretend and put on this show. And so some of the feedback that I got was that, I was soft spoken and I needed to speak up and, you know, I wasn't confident and things like that. And so, that was definitely hard because, I kind of felt like a lot of it was like attacking my personality. And so, and I think it's really kind of interesting too, because there's this stereotype of like the angry Black woman. And I'm like, not that obviously. And maybe it's a little bit confusing to some people, but yeah, it's just me and that's not me.
Yeah, I think that's a great point. And what it makes me think of when you talk about like those are just kind of complaints about your personality, which like obviously many more of us love your personality. It is a very unique personality and there isn't like one right way to be a female surgeon. Everyone has their own preferences because I think that maybe like the overly confident or aggressive or intimidating female surgeon, that's not my favorite,
Yeah.
disposition.
Yeah.
But what it really intersects with that a lot of people increasingly over these past few years have pointed out, like in literature and conferences, is this nebulous quote unquote professionalism end quote piece of like the curriculum. And that's a piece of graduate medical education. It's not very well defined. It's extremely easy to weaponize it against people because like somebody might say, well, this woman is pretty soft spoken, so I don't find that like professionally very appealing to me. Whereas like on the other end of the spectrum, I am perhaps loud spoken. I am more direct, and then people will be like, this woman doesn't have enough tact. Like some, but not the amount that I want. And so professionalism, especially against minorities in residency, that's where a lot of this discussion comes, is like, how do we make that uniform for all? Because from a professionalism standpoint, it can be easy for like the old guard of medicine or hospital administration to say, well, this specific Black hairstyle is just not professional and I won't have it.
Yeah, definitely. So I think that is kind of like the key where some of this stuff becomes really difficult is because, the stats that you mentioned that Black residents are more likely to be dismissed from a residency program. The problem is that a lot of the time reasons that they're being dismissed are subjective, and professionalism is one of those ACGME core competencies. And so if you're lacking in any of those core competencies, then you can be reprimanded, you can be placed on probation, you can be dismissed from a program. And so there's 6 of these competencies, and professionalism is probably the most subjective of all of them, but some of the other ones have some subjective components as well. And so the issue I see is that we need a more standardized approach to like when talking or what to bring disciplinary action on residents. We need more objective criteria. And so the ACGME currently does not have any guidelines on how this process should work. If you read their guidelines, they say it's up to each institution. And so each institution is getting to decide, what's acceptable, what's not acceptable. Let's say you don't get along with some of the administrators at one of the institutions. They can decide, you know, I don't like this person. And they can use some of these subjective criteria to get rid of you. And I'm not saying that there's not bad physicians, there's not people that should not be completing residency. There definitely is that. But we should be able to find a way to get those bad apples out using objective criteria and not get people that could end up being good physicians and good surgeons out. And the thing that also, I know I'm talking a lot, but the thing that I also want to mention is that the more that we lose, minority physicians, female physicians, that creates less diversity in our workplace. And really, what this comes down to is our patients. There's been lots of studies that show that minority patients do better and they have better outcomes when they have a physician who looks like them. There's
Yep.
been studies that show that female surgeons have better outcomes. And so if we're losing Black physicians, minority physicians, and female physicians to these random, vague, subjective criteria, we're losing our workforce and we're preventing diversity in our workforce, and it's hurting our patients.
Totally agree. And like I truly agree that that's the case now. And over the next 20 years, the patient population is only continuing to diversify. And so medicine also needs to diversify with it. So not only are we like a lot behind the eight ball now, but think about kind of as we move forward how this is only going to be more and more true.
Exactly. And, a lot of our efforts are focused on like getting people into med school and getting people into residency. But what happens after you get into residency? What happens as an attending? Like, there's also been lots of studies and research that says that even Black attendings have issues like with coming up for peer review and not being able to make the same kind of mistakes as some of their counterparts. And so all of these things are, good things to talk about and think about in terms of like, how can we make this better for, future trainees, future attendings, and our patients.
I agree. Like, those are just such reasonable places to start. And, it's important that people like role models in the community, like yourself, kind of just put names to some of the phenomenon that have been happening. Like, none
Hmm.
of this is new. It maybe
Yeah.
is new that people talk about it in any way
Yes.
or look it
Yeah.
in the eye. One question I have, and this is just, it's interesting to think about because you mentioned how there can be, like, hopefully in many parts of the country, there's support for people to like get into medical school to kind of make it through. Then the med school will support you through your education there. But then
Hmm.
sometimes in residency, like, sometimes we don't control where we match and we end up transplanted somewhere where we don't have an existing support system. And that can make it really difficult, especially difficult if any problems arise. But I wonder what could be done in terms of like better regional and national support for trainees who, yeah, may be like marooned somewhere. And what if they are like the first Black resident in their program or like one of the very few at their institution? What do you think would be good next steps in terms of like,
Well, there are, so it's kind of like how people probably find, your website and things. They're like, I'm having a hard time in residency. Let me Google something. And so there are kind of some resources out there for Black trainees. There is the Black Otolaryngologist Network, who are very active, and they give, advice on medical school interviews, attending interviews. If you're having difficulty within a program, they can help support you through that. There are a number of organizations that specifically are geared towards helping Black physicians who feel they are unfairly being remediated or dismissed from a program. And I can, you know, compile some of those resources.
we can link that? Like, what is that one called? Well, we'll link it at the bottom of
I
the show
don't know
notes.
all the names by heart, but I can definitely there's a few, but I can definitely share those with you. We do have a Black Women in Otolaryngology group as well. So all of these are out there, but yeah, I'll definitely send you some of those links later.
Yeah, I mean, I do think that the internet has helped a lot. I mean, I just can't even imagine, like 15, 20 years ago, before some of
Yeah.
these widespread networks, it's like, okay, you might be really marooned like 300 miles from the nearest person who could give you expert advice on what you're experiencing or things like that.
And the other thing I will say is like you don't have to get someone who looks like you. Like an advocate can be anyone. Like one of my biggest advocates or was the chief the year ahead of me. And so she was always there to give advice, to, help me when I was having difficult times, when I was getting negative feedback about, my personality and things like that. She was great. I had maybe one or two attendings that definitely really advocated for me during residency, and, none of them were Black. There are people that maybe consciously or unconsciously like causing problems for Black residents, but they're on the other end of the spectrum. There are a lot of people who see that there's been problems and want to make sure that doesn't continue to happen, that want to give people opportunities to thrive and be successful. So it's not just all bleak. Like the opportunities we have are so much greater than they've ever been. People are realizing what has happened, and it's really changing our landscape right now.
Totally. And of course, I do agree with you. It's not all bleak. I
Yes, you
I
do
mean,
agree with me. That's right. I'm just kidding.
no, I do. I'm just kind
Yeah.
of a bleak person, so you got to ignore me if I'm being too bleak. But
Yeah.
again, like this goes back to like I really admire you. I think you're a better woman than I am because you do, even in the face of adversity, even in the face of like some of even these systemic issues that we're talking about, you show up to work with an incredible attitude, like a positive disposition, and and you just really never put that on other people, never take things out on other people, and I just really love that. And I kind of, I wish that there were more people like you out there because then I'd be a little less bleak, I guess.
Yes. Yeah.
But I do think, yeah, but I think in the next generation too, like, yeah, it's increasingly moving towards maybe like not taking stuff out on people at work, and also just
Yeah.
being able to see the positive, just be effective about problems, because like you're saying, there absolutely are people out there who want to mentor, support, things like that, and it's just about
Hmm.
finding them. And totally
Yeah.
agree. Like similarly, my mentors didn't look like me, but interestingly, I do think that oftentimes women do understand some of the
Yeah.
issues that female doctors face a little bit better. But not to say that I don't have incredible, male mentors as well. Do you have any pivotal moments that you can think of during your training that did significantly shape your career as a surgeon?
So yeah, I kind of alluded to some of the issues that I had in residency, but the most significant and why I'm so passionate about this is because early in my third year of residency, I received what they termed a letter of counseling. And it was a formal letter, and it noted all of these deficiencies that were very vague and subjective, like we were discussing before. It said that I needed to take more initiative. I needed to work on handling my fatigue. I needed to be better at multitasking. But there was no concrete examples of when I had made a mistake. There was no anecdotes of me doing something wrong. There was no comment on my medical knowledge. There was no comment on my surgical skills. And this goes back to me feeling like it was an attack on my personality. The other thing is, if I had been struggling so bad that I needed a formal letter, then why hadn't this ever been brought up before? So we're now, I've been first year through second year, and we're now, partway through third year. And out of the blue, I'm shocked. Like, I didn't know we had an issue. so if there was an issue, then there could have been meetings before that, like saying this is what we've seen. And they did say that I was soft spoken, but no one ever said like we're worried about you because you're soft spoken, like we're worried that you're not going to be a good surgeon. And so that was very hard. And it was the hardest thing that I went through in residency, because when that happens, you feel a enormous sense of shame, feel like you're not good enough. Even for me, it was even worse because like I felt like they just didn't like who I was, like, okay, you just don't like me and now you're trying to get me out of the program, which I don't know if that was really the goal, but I did have some attendings say like maybe you should look into a different specialty based on like these subjective things. And so that was just really hurtful. I became depressed. I went on an antidepressant for the first time in my life. Yeah, I was just probably at one of the lowest points that I had been throughout residency and throughout my life. And, I haven't had like that hard of, or that like easy of a life. So to say that is really not that I've had a hard life, but I'm just saying like I've been through really hard things, and that was really up there in terms of like how it impacted my mental health and things like that.
I'm so sorry. I just honestly, I listen to you and I have to like try to not cry, and also I sweat through my clothes because, like I can imagine, and many of us in medicine can like relate to at least even feeling like maybe blindsided by something like that or feedback or anything. To have gone through what you've gone through, and then again, like in my experience for the listeners and everything, when I was a first and second year and you were a fourth and fifth year, I never knew that. No one would ever know that. People were like, this is a very chill, competent chief. You were very well liked. So it is all, and that's a good thing, I think, because that's a testament to
Yeah.
you. And it also helps show that even when there is like that personal pain and journey that accompanies something like that, outwardly, you were living your life in a way and then like practicing ENT in a way that garnered a lot of respect. And so it's kind of nice to think that like the truth wins out in the end, and that like you just keep doing what you're doing.
Yeah.
Do you feel like you did anything differently, or did you just kind of like keep doing a good job, keep showing up?
So I think what I did differently is I tried really hard to change the perception. And so, like, which maybe, you could argue that maybe it made me a stronger surgeon in the end, but I tried really hard to, like, find a stronger voice to build that confidence. I think once I did that, people were like, okay, we're good, and I'm not saying like it was right. I think maybe in a different program, it would have been handled differently. And I think the culture of a program can really change how something like that is managed. Like some programs, I wasn't attending at a recent program where I feel like that may have been a positive thing, having a personality like that. They would have valued that. And at my program, it wasn't really valued. And so, that goes back to like what we were talking about. Like it's all so subjective
And location dependent, like you're saying. I would
Yeah,
agree with
yeah,
that. It's
yeah.
regional.
Different
Hmm.
institutions. Yeah. And so it was hard. But yeah, that's what I did to kind of like
That's
change
awesome.
that perception. And, I think I had to meet with my program director once a month for about 6 months. And then after that, everything was fine. And, I feel like I'm did great in residency, and that's another thing, like you can overcome these things. I feel like my story is like very benign to what some people have experienced, because from what I remember, there was 5 Black surgical residencies that like I remember at the total residency program at where we went to residency. And so I know that I received formal letter. I know that two of them were dismissed. I know that one of them was held back a year. And I know that one that graduated had been dismissed from another program. So out of like all the Black surgical residents that were at that program while I was a resident, all of them had issues. And obviously the sample size is only 5, but I mean, like, how can every single one of them have issues? Like, maybe they did, maybe they didn't, I don't know, but it's just fishy.
Yeah, I mean, issues to the point of like formal disciplinary, because
Well, exactly. Everyone has issues in residency or like mistakes, whatever, but to have formal disciplinary action or a remediation year or being completely dismissed from a residency program. And I know one of these people was dismissed as an intern. And like, I don't know what kind of mistake you can make as an intern where you have to go find another residency program. And so I know that he's like a successful ER physician and there is like life after something like this. But from, the statistics you shared, Black people make 5% of trainees, but 20% of dismissals. Like from my experience, that I'm not shocked about that statistic. Like it makes completely a lot of sense.
Yeah, and I mean, it's upsetting to kind of even like think too much about, and certainly to talk about. I agree with you. I think that part of like what we talk about here is just that I think all residents have issues. I've never met like an extremely well-adjusted resident. Like, no offense to residents, I've never met someone and I was like, man, you are like 100% killing it. Like typically, even if there's somebody who is truly like handling the job very well and that they seem even in like pretty good spirits about it, like they seem to have some good perspective, those people are still drinking themselves to sleep every night at home. So like I've never truly, or they're, I mean, they're doing something else pretty insane to cope, very difficult experience. So yes, kind of this line between who receives formal disciplinary notice or action or anything like that and who doesn't, it's just kind of it's obviously it's not been fair. The more that we can like look at this, I mean, I think that if people also feel like eyes are on this issue, or maybe if institutions are like, man, like some of our numbers are crazy, like I'd hate to be on CNN for this, like you would hate to be on CNN for this, like get together, like quit doing it. So I think that that's all wonderful. I mean, I do want to share the story real quick of like your final grand rounds, which I still totally remember. Like I remember it like it was yesterday. I thought it was really beautiful because, you gave a good grand rounds. I'm sure it was on like the inner ear or something. I was like, not the content part, but then the end and the close. You were just like, this is my last grand rounds. Thank you guys. Like, what a ride. I'm paraphrasing because obviously you don't talk like that. But like, between the lines, you were like, what a ride. Like, all right. Well, I'm almost done. And thank you guys for, the love. But you put up this slide of a unicorn and you said, look, 1% of ENTs are Black. And to be a Black female ENT is like a true unicorn. And it was just very powerful. It was very impactful.
Yes, I think when the data that I used was from 2016, and I was able to get like a rough estimate of the number of Black female ENTs. And in 2016, from my rough estimate, ENT residents, there were 11 Black female ENT residents in the entire country. And that's obviously a really small number. And so I just wanted people to realize, like, yes, it had been a wild ride, and it's also like means so much to me to be a part of that small cohort of people. It meant so much to me to be the first Black resident to graduate from that ENT residency program. I feel like, hopefully there's only many more to come. It was a hard ride, but it got there in the end for sure.
Oh my gosh. One day, I mean, I got to tell you, I have like a graduation speech that I wrote, unpublished,
Really?
not given. Yeah. Yeah. No, it's great. We'll have to it'll be like in the archives, or it'll be like published posthumously for me.
Please,
Oh
please.
my. No, that's all. And I, of course, like I'm still thinking about what you said with the stories of like the 5 Black surgery residents at our program from when we were there. And I do think, like, of course, the fact that that one guy who was dismissed somewhere else, he came to the program and then, and then graduated, like that
Yeah,
kind of helps validate that there wasn't something dangerous
yeah,
or,
yeah.
untenable about
Mhm.
him as a physician.
And I think all of these people are practicing physicians and thriving. So I will say, I know that's not always the case, that, you get a new residency program or whatever, but a lot of times it can be the case, especially, if you advocate for yourself, if you find other people to advocate for you. The only other thing is like, even if you do end up, being successful, that something like that takes a huge toll on you. It really messes with your mental health. So I don't want people to take lightly giving people formal reprimands or, remediation or dismissal. Like and it follows you the rest of your career. And so there's a lot of shame with that. There's a lot of stress and anxiety about, is this going to make an impact on where I match for fellowship, where I can get an attending job? And so it's more than just like what happens in the end. Yes, we're all successful physicians, but what did you have to go through or give up to get to that place? That's something to think about and consider as well.
I love that. That's a great point, and I appreciate you making it, because that is like one of the major takeaway points. I totally agree. It reminds me of Dr. Stephanie Simmons, the chief medical officer of the Dr. Lorna Breen Heroes Foundation, came on the podcast, and I loved her message directly to, like trainees. And the message was, we don't want to lose you, and we don't want to lose part of you. And,
Yeah.
you and I both survived. Like, I'm
Mhm.
technically alive, extreme. Like, I mean, pretty bleak, kind of
Yeah.
like a shell of a person. But, like, in all seriousness, I just thought it was really, I loved how she also shouted out, like, well, what about the cost? What about the things that we give up because of things
Yeah.
we experienced during training? I wouldn't have necessarily like agreed to give those up. Sometimes but then you blink and then like you're at the end of training and
More.
you gave up more than you would have ever consciously agreed to.
Yeah. 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 I heard that. I love that when she said that.
I really, really appreciate you. Obviously, I could talk to you about this for 100 hours, and I really, really appreciate your time. I mean, like I said, if you ever want to come back and we hit other important topics, which include like work-life balance,
Yeah.
Avery, your cat,
Yeah,
who is
my
like kind
cat.
of an internet sensation, yeah, very beloved. Talk about ways that you are able to prioritize quality family time, things like that. Like, we would always love to chat with you and learn from you.
Thank you so much. This was really fun. Thank you.
Yeah, wish you the best. I mean, you're just a good role model, because like people, I mean, I know my family is going to have something to say to me. They're going to be like, look at what like handling it with grace looks like. And they're going to be like, and they'll be like, do you feel like you want to handle it with grace? And I'll be like, mm-mm, no,
Negative.
no,
Yeah.
I'm just kidding. I'm getting there. And so I definitely
Yeah.
appreciate every role model, people like you who are out there, like I and all women, in the next generation for us. Like, hopefully we just like are picking it up and
Yeah,
learning as well.
definitely.
Well, thank you so much for joining me today, Dr. Okatu. It is such a sincere joy to chat with you, and thank you again for all of the personal mentorship that you've provided me over the years as well. Follow me on Instagram at francismay.md and at Rethinking Residency. Visit my website, rethinkingresidency.com, to learn more about resident physician stories and ways that residents can most effectively navigate the game of residency. I cannot wait to connect with you on the next episode of Promising Young Surgeon.